and this is Lerato, President of Young Nurses Indaba Trade Union. Welcome to my YouTube channel.
Tell us more about your channel.
We've dubbed this channel the Essential Channel simply because it's aimed at talking about everything essential. But most importantly, it's aimed at supporting the essential services during this difficult time, particularly healthcare providers, those who are in the front line of fighting COVID-19.
What is today's topic about?
We are going to be talking about a whole lot of things, but we'll get to that later. But today, as you ask me, I want us to talk about the elephant in the room. So we've been really inundated with calls about people asking, during this COVID-19, as a healthcare provider, will I be compensated double? Will I be getting a danger allowance? Will I be getting... There's a lot of questions around compensation, but that doesn't mean that our healthcare providers are not committed. It's clear, I mean, we've talked to so many, it's clear that everybody is prepared to ensure that our country is back and the wheels of economy are running again. But, again, the elephant in the room, my topic is compensation. I want just to really talk about the facts so that we dispel the myths and we really deal with the issue at hand here. First and foremost, let's visit our basic conditions of employment. We all know that public servants, they work for a 40-hour week. And in that 40-hour week, depending, for healthcare providers, quite different because we have a shift system, but ultimately in 3 months, it all rounds up to 160 hours. But this time, the entire country is put on lockdown. The president has said, everyone, if you're not essential, you stay at home and you are paid. I think that's where the question is coming from. Essential services now asking, but what about us? We are not saying we don't want to assist. We are asking, are we going to be considered for an additional pay? Or even better, will this time be calculated as double time or time and a half? Or it's just going to be set to be normal hours? Now, we are aware because we are following every memo, every gazette, every legislation that comes during this time of COVID. And so far, the country has not made that determination. Who is supposed to start that conversation, you ask me? I want to remind you, in our country as healthcare providers, we've got two important institutes, which are two bargaining councils that we fall under. The first one is the Public Health, Social Development and Sectoral Bargaining Council. In abbreviation is the PHSDSBC. And in this first council, I'll come to the second one. In this council, we know that only unions that are deemed to have majority of employees subscribe to them get to then sit with the employer. The council becomes the mediator, and then they can then begin to talk about issues of salaries, issues of benefits, issues of allowances. So this one particularly also falls within that. It's well and good to ask a union such as YNITU or any other union that is admitted in the bargaining chamber to say, are we going to be getting compensation? And rightfully so. But we must remember that, I'll make a very simple analogy. When we vote, we put our eggs so that a certain political party can be the majority. And that political party then gets seats in parliament. Is the same model in democracy. Even in bargaining chamber, it works like that. If we are going to put our subscription, we are going to fill our forms and say the majority union is X union. That union, then we have majority of the healthcare providers have trusted them to begin to then be a pain in the neck of the employer. But that's not the case. We all know that. Will we be getting additional pay? Will we be getting a danger allowance? Will we be getting a time and a half or double time? It is entirely on the unions that the healthcare providers have trusted. And it begins to be extremely unfair if we are not happy that we do not do what is right. I understand it might be looking like a bad time to really campaign or say join YNITU. Healthcare providers would not be contacting the only relevant trade union in the country to say, help us, do something for us, if they did not believe that YNITU can actually do that. The challenge is, it is entirely on the hands of the nurses to decide who then begins to speak for them, not now in the times of Corona only, and even beyond Corona. Colleagues, it's an essential topic that I'm raising right now. And like I said, I'm not going to try and tiptoe around the facts. The fact remains that when the Disaster Act was enacted, a lot of opportunities came. For the first time, you will work with me here and you will agree with me. A lot of us, we then began to realize that really our community knows that we are important. Our doctors felt important, our nurses felt important. Currently, we are putting ourselves in the battlefield even without the bare minimums, because we know that the survival of our country is right in our hands. All I'm asking from you is that you put yourself first. You really put yourself first as a nurse, as a healthcare provider, and put your eggs where it matters. I'll make another